Government's response to the consultation on DLA reform and personal independence payment, completing the detailed design. Contents. Executive Summary. Introduction. The consultation. Breakdown of responses. Summary of responses. Benefit entitlement rules. Changes to residence and presence conditions. In disability living allowance. Attendance allowance. And carers allowance. Payability of personal independence payment. Reassessing existing disability living allowance claims. Equality impacts. Annex 1. Feedback and responses. Annex 2. Passporting arrangements from PIP to other benefits and schemes. Annex 3. List of organisations that responded. Executive Summary. 1.1. In introducing Personal Independence Payment, PIP, the Government's aim is to create benefit which is fairer, more straightforward to administer, easier to understand, and financially sustainable. We have consulted extensively with disabled people, the organisations that represent them, and independent specialists in health, social care and disability during the development of our proposals. (1.2) The Government published DLA reform and personal independence payment, completing the detailed design, on the 26th of March 2012. The document sought views on eligibility rules for PIP, payability and reassessment, as well as associated changes to the residence and presence rules for disability living allowance, DLA, attendance allowance, AA, and carers allowance, CA. The consultation closed on the 30th of June 2012. We received more than 1,600 responses, including nearly 1,500 from individuals. 1.3. As a result of the advice received from disabled people and their representative organisations, we have made a number of important changes to the detailed benefit rules. The key changes are: the linking rules will allow for a 2-year linking period for people under the age of 65 and a 1-year period for those over 65, during which a claimant could reclaim the benefit without being required to reserve the 3-month qualifying period. Regulations will set out that this will apply where the new claim results from substantially the same condition or conditions, or one which developed from the original condition. We will contact the young person at age 16 or their appointee to tell them what they need to do to claim PIP. As part of our administrative procedures, we will contact the parent or guardian as the young person approaches 16 to make them aware of the changes. Within PIP, a temporary absence abroad of 13 weeks will be permitted, or up to 26 weeks if the absence is specifically for medical treatment. This is in response to comments that the proposed 4-week maximum was too short, particularly for students studying abroad, and addresses concerns that some disabled people need more time to travel and to recuperate. We will use the same rules for DLA and AA. We will maintain the reassessment arrangements which allow for a period of 4 weeks in which to claim PIP, after which DLA will be suspended. But we will also include a discretionary provision to extend this period in exceptional circumstances, where the Secretary of State considers it reasonable, for example, where the claimant has recently gone into hospital. (1.4) While we have incorporated many of the suggestions received, after careful consideration and evaluation, we have decided to keep the following proposals. Claimants will have to satisfy a habitual residence test to align with the residence test with other benefits, and have spent, as a minimum, at least 2 out of the last 3 years in Great Britain before they can access PIP. We will treat serving members of Her Majesty's Forces and their families as habitually resident in Great Britain when serving and stationed abroad. We will use the same rules for AA, DLA and CA. PIP will not be available to new claimants beyond the upper age limit, age 65 or pension age, whichever is higher, except where they had a previous claim to PIP which ended within the last 12 months, or where they applied before that age, but that claim was not decided. Anyone newly claiming over the upper age limit will instead have to make a claim for AA. Payment of the daily living component of PIP should stop after 28 days for publicly funded care home residents. But payment of the mobility component would continue where appropriate. For hospital inpatients, payment of both the daily living and mobility components of PIP would stop after 28 days. We will suspend payment of PIP to prisoners after 28 days in detention. In calculating the time in prison, periods less than a year apart will be aggregated. (1.5) Although not part of the consultation, many points were raised about the measure to remove the extension of payment of DLA beyond 28 days, 84 for persons under 16, for hospital inpatients with a motability vehicle, and not to replicate that payment extension in PIP. We will allow a 3-year grace period for those DLA recipients who have a motability vehicle and are in hospital when the new rules come in. For those who enter hospital after the new rules have been introduced, Motability have confirmed that their policy is to allow a grace period of up to 28 days after payment of the mobility component has stopped, during which they will contact claimants about terminating the lease and returning the vehicle. They will also consider deferring termination of the lease on a case-by-case basis. Motability also state that any advance payment outstanding will be returned on a pro rata basis. So, claimants will not lose out financially. 1.6. A number of other points were raised on subjects outside the scope of the consultation document. The government response to these will be explained later in Annex 1.